Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Today I wanted to talk about this new word that I learned recently.
Very cool word.
Very cool word. Iatrosedation.
So what does iatro mean?
I have no idea.
Iatro means that is induced by the provider.
Oh, is that right?
Yeah. So like
Okay.
iatrogenic.
Like iatrogenic damage.
That's right. So one way that we were taught in dental school is iatrogenic damage means that damage that's like caused by the
provider
dentist,
did something.
right? So they went too far, made a hole they shouldn't have, or something.
Right, like iatrogenic.
Yeah, or sometimes when you like preparing a crown, if you nick the adjacent tooth by mistake, like you
Right.
touch the next tooth. So one thing is like, be careful not to cut the wrong tooth, right? And if you do it by mistake, that's called iatrogenic
damage.
Yes.
Well, but iatrosedation,
Yes.
that means the relief of anxiety through the doctor's behavior.
Right.
So there's a few studies showing how important the doctor's behavior is in post-operative pain and healing.
Mm-hmm.
And this is something that, like, as dentists, we wouldn't necessarily, we were, first of all, never taught about this ever in dental school.
Not really, yeah.
And second of all, it's not something that we would consciously think about. But it has been shown, and we'll go through the studies, that the doctor's behavior before surgery can affect the level of pain that the person has after surgery, which is crazy. I mean, if you think about it,
Yes.
like how the doctor behaves can affect your pain level. It's
Yes.
crazy to think about.
So in this first study, they had 3 groups of patients, right? In the first group,
There was a visit from the doctor before the surgery,
describing everything.
describing the surgery and describing what's going on. In the second group, there was no visit from the doctor describing the surgery, but the patients were given a sedative to take before
Yes.
the surgery to help them be calm.
Yes.
And in the third group, there was both a visit and a sedative.
Yes.
So the first group of patients, when they arrived for their surgery, that had no sedative, but they were calm.
They were calm.
They were
Yeah.
calm. The second group,
They were actually sedated or had some like light sedative.
yeah.
But they weren't calm.
They weren't calm. They were just drowsy, but they weren't actually calm and relaxed. They were just drowsy,
Yes.
but they were still anxious.
Yes.
And the third group was calm and drowsy. Surprise, surprise.
So, I mean, you think that a sedative would help you be calm, but it really doesn't have that effect. The doctor's words
The
had the
doctor's
effect.
words had more effect on making you calm before your surgery, like on the day of your surgery, than any drug.
Yeah.
So that's amazing to me.
It's very interesting, right?
It's
you
crazy.
think, we talk to our patients often. If they're coming in for a surgery, even a dental surgery, we say, we'll give them something to take the night before to help them be calm.
We give everything in writing. You have to sign 1,000,000 pieces of paper.
Yeah, but you even give them a sedative to take the night before and
Right.
then in the morning. But maybe a phone call the night before would be even.
That's probably the best thing rather than,
Interesting.
it's crazy.
Yeah.
The second study is even more interesting to
Mm-hmm.
me. So there were 2 groups of patients who had pretty big surgery, abdominal surgery.
Yes.
So they were divided into 2 groups. The patients in group 1 were not told about any post-operative discomfort or pain following the surgery, but they were told that painkillers would be available should they need it. The second group were told that they should be expecting some post-operative pain and discomfort. The type of pain and the level of pain was described to them.
Yeah.
And they were also told that painkillers would be needed should they need it. What do you think happened here?
Well, so it seems like the first group that was the first group told or not told?
Not told.
Not told. The first group that was not told had more pain.
Had more actual pain.
Yeah, so they had actually more pain, ended up remaining in the hospital for
an
close
average
to
of 2.7 days longer, and needed more analgesics, more painkillers after their surgery.
yes.
So this is the group that was not told about what to expect after surgery as far as pain, but was just told that there will be painkillers if needed. The group that was kind of told, okay, this is what you're gonna, feel. It might feel like this, it might feel like this, expect some pain. They actually experienced less post-operative pain.
Yes.
They ended up needing less painkillers, and they ended up leaving the hospital on average 2.7 days earlier.
So almost 3 days sooner.
That's crazy.
And it's interpreted in two ways. One is patients who are told to expect pain can tolerate it better, or patients who are told to expect pain feel less pain.
No, it's definitely that they feel less pain.
But that's the two ways they interpret this.
Right,
Either they're
right.
tolerating it better, or they're physically actually not experiencing the same
As
level
much
of pain.
Yeah.
Which is very cool. What a psychological effect just you knowing and expecting has on
Yes.
your body's
Knowing
ability
what
to handle
expect,
things.
and just being ready for it. But it shows the power of communication. Both of these studies are just about the power of the doctor's communication with their patient and how it can affect the results of your surgery and your post-operative healing period and all this kind of stuff. And it's just amazing with that crazy healthcare cost that we have. Imagine if people could leave the hospital 2.7 days earlier.
How amazing
Like,
is
how
that?
many millions of dollars is that?
Would they save? And then your life, like being able to get back to your life.
Of course, and taking less pain medication. And
Right.
that is like, these pain medications can sometimes be addictive and can cause all kinds of other things. So if you have good communication with your doctor, if you're told what to expect after, if you're ready, you're more likely to experience less pain or be ready for whatever you're going to experience, take less pain medications, and recover much faster.
And honestly, it's like it should be this should be the minimum standard of care, to let your patients know what to expect.
But it's not.
But it's not, which
but
is
it's
very
not,
sad.
because everything is so squished. Doctors don't have time. There's like a million staff coming and going. And I know patients have told me, like, they go to other dental offices and they're seen by a different person each time they go in. They're never seen by the same dentist. They're never seen by the same assistant. So there's no communication there. And
Yes.
that communication is crucial. It's like a huge part of your well-being, your healing, your level of anxiety and pain.
Definitely.
And it's important to have that. And unfortunately, that has been put aside in today's, not just dental, but medical.
As well, yeah.
Yeah. And it's like, obviously these two studies, there's more studies that shows this, that patients who have good communication with their doctors and providers have much better outcomes than patients who are just shuffled around. So it matters a lot.
I think, and it's part of just being honest too. I wonder sometimes if providers are not saying things because they don't want to scare people away, or it goes with fear of the unknown.
Yes.
For the patients. And often we have patients who come, coming to the dental office is scary for a lot of people, right? It induces
It's
a lot of
huge.
anxiety for
It's like
people.
the second biggest fear after public speaking.
Right. So
It's crazy.
so one of the
It's
main
higher
things
than death.
one of the main things I do is sit down and look at them face to face and be like, how can I help? And this is what's going to happen today, and
Right.
here's what we're going to do, and this is what to expect. And there are certain dentists out there who are like, don't tell your patient that they might have some discomfort after the procedure, because maybe they won't. But I think that that's wrong. Like, you need
Obviously, yeah.
right?
According
And
to these
especially
studies,
according to
it's
this.
wrong. You should. Well, I guess as a patient, what should you do? As a patient, I think you should demand some clear communication. Like, what should I expect? What kind of pain should I expect? And just be ready for it, because obviously, not just dental, but any kind of procedure has side effects, has pain, has different things, and that's normal. That's part of it. But knowing what to expect and having good communication with your provider can actually decrease that a lot.
Even some small things like letting them know how long the visit is going to take.
Yes.
If you're doing braces, how long is this treatment going to take?
Yes.
You know, and being able to give them a clear understanding of that, you know, so things aren't worse. And worse often, I will look at a tooth and be like, well, it might need this, or it might also need this and this. Like, we don't know until we open this tooth up and see how bad the cavity is or whatever.
Right.
And getting them prepared, sort of like, these are the maximum things that could happen,
This is the worst case scenario
This
that
is
could
the worst.
happen.
And it's not to induce fear in people, but it's to prepare them, you know?
Yes.
You don't want to be surprised with these things.
You don't want to be surprised, and you don't want to feel like you weren't told. I think that's really a bad feeling as a patient. Like, I had a procedure on Monday, and it was like I was in a conveyor belt.
They just like pushed you around?
Basically. like I swear, I think like 15 different people came in. Like, I had no idea like who was coming and who was going. And I was just like, oh my God. I mean, everything went fine, thank God, but
You're standing.
there is none of that like, hi, I'm Dr. So-and-so. This is what we're going to be doing today. This is what you should expect today. Or not even the doctor, like anybody could come and have explained a little bit to me.
Right.
But it was none of that. It was like you're in a factory. Like, you just go.
That's too bad.
Yeah, it's a little crazy out there.
So human connection.
Human connection. Right. And one of our good friends, Melanie Dewar, is actually started a concierge medical practice just because of this. Because she was feeling so disconnected
to her patients.
Yeah. And she is like a very thorough and meticulous person, and she wants to make sure she like follows her patients. So she started this whole practice that basically she's 100% on top of everything to do with your health and well-being.
Amazing.
And I think people who have that kind of level of care are going to definitely get better results. Outcomes.
I love that. And there is the whole concept of that in dentistry too. Slow dentistry. Slow down. Take more time.
Yes.
It shows that if you take more time doing a procedure, it's more successful. They've done studies on this. Dentists who take half an hour to do something versus the one who takes an hour and a half to do it doesn't necessarily have to do with their skill level. Speed is not a good thing.
Not always. Definitely not.
So
the whole idea of efficiency, speed, all this stuff that we've been taught that are like golden standards of like, oh, you just shuffle the people like what I was shuffled on Monday. You just like get them through the procedures. That's not always the ideal thing when it comes to healthcare. Slowing down, communicating, setting clear expectations, and having good communication not only benefits the patient, but it's good for us. Like, we want to be like clear. We don't want you to feel like we did something that you didn't understand or you didn't expect.
Totally.
We want to be clear, and also it's better for you as a patient too.
Yeah.
To have clear outcomes.
Yes, but insurance often, if you take insurance, if you're in network, so all of these things, more time means more cost, right?
Oh my gosh, let's talk about that practice that our associate went to. Oh
right.
My gosh.
So we have a doctor, she's amazing, works with us twice a week, Dr. Golara, and she went to an office to pick up another day of work somewhere, and it's an HMO office. And she came and she was telling me about how awful it was, because in HMO offices, it behooves the practice to
not do treatment.
Certain types of treatments are are already like kind of paid for.
Basically, certain types of treatment you don't get paid at all for doing it or not doing it. You get paid like a certain monthly stipend per patient.
Whatever, regardless of what gets done.
What they're gonna need.
Yeah.
So this practice was actually avoiding doing the more preventative type of treatments.
They would wait until like let's say you have a small cavity, you go in there, but if they did that small cavity, they wouldn't actually get money for it.
They would get nothing.
So their standard is to wait and watch that thing until it's big enough that, let's say now it needs a crown,
Right.
and the practice would get paid for a crown.
Right.
So then they would diagnose it as a crown. So they would not diagnose the cavities until they were big enough to require treatment that would bring in funds for the practice from the insurance.
Right. This is just how crazy our system is and how like effed up the incentives are. So
You
it's
can't just blame these practices.
No,
it's,
you can't.
It's the
not
structure
about-
of
it's the
these
structure
insurance
of
companies.
the insurances, and same with the slow dentistry. You're not like we don't get paid more for slowing down.
Right.
So, and a lot of times with dentistry and with medical things, the results don't necessarily happen right away. It can take years
Before you feel
before
the
you feel
consequences
something
of that fast procedure.
of that fast procedure. So
Right.
there is really no incentive for providers to be slow or to take more time, other than if you just want to be a good person.
And you
But-
charge more for your time, and you're not in network with insurance.
Yes.
Ultimately, it comes down to that.
Yeah. Okay. Well, anyways,
We could talk about
we
this
could talk
forever.
about this forever, and I think we should have another episode on this.
About insurance
About
and its effects.
insurance
Because
reimbursement.
really, you want your goals to be aligned with your provider's goals as
Yeah.
the patient. So if you're in an HMO type of practice, your goals aren't aligned
Right.
with your providers, which is too bad. That's what we should aim for.
And communication, like we saw in those two.
And
slides.
communication.
Communication decreases pain.
It's one of the reasons
amazing.
we're doing this podcast.
Yes. Okay. See you next time.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.